Let me turn it over to our great health commissioner to give an update on coronavirus.
Thank you, Governor. Good afternoon. As we have said over the past few weeks, the risk to the public in New York State is currently very low. The department is in daily communications, often several times a day, with our colleagues at the CDC, at HHS, at New York City Office of the Department of Health, the Port Authority and local health departments, and healthcare providers statewide. And together we are all closely monitoring the developments in China as well as here in the United States. There are 12 cases nationally, and our focus continues on aggressively identifying any new potential for exposures among travelers returning to New York. Now, regarding travel, there have been several reports regarding a cruise ship that was docked in Bayonne, New Jersey. What we can tell you is that we understand 4 individuals have been taken to University Hospital in Newark for observation, but that none of the individuals were experiencing symptoms consistent with novel coronavirus. We've added this novel coronavirus to the department's list of communicable diseases, which requires healthcare providers to report persons under investigation to their local health departments and ultimately to the State Department of Health. Reporting and investigating of cases is already taking place, and adding novel coronavirus to this list will improve our ability to coordinate efforts with local health officials to control the spread of the disease if necessary. Additionally, the Wadsworth Center, which is our New York State's public health lab, is working closely with the CDC to get the ability to perform the test for the novel coronavirus, and we're working quickly to implement that testing. The bottom line is we are very well prepared for this response, and New York State and local public health officials and all the healthcare facilities are very experienced with infectious control practices. And while the novel coronavirus is not an immediate threat to New Yorkers, let us please not forget that the flu is still prevalent in New York State and has not yet peaked. According to the latest surveillance report, last week alone, 1,889 New Yorkers were hospitalized with lab-confirmed influenza. And that same week, 17,321 lab-confirmed flu cases were reported. That's a 15% increase from the week prior, and one of the highest single weeks of activity we have seen. And there have also been 13,460 flu-related hospitalizations this season since around October. So every day, preventive actions can help stop the spread of both flu as well as the novel coronavirus. Wash your hands often, cover your mouth or your nose, and when you sneeze into your sleeve. Stay home if you're sick. This is really important. If you're not feeling well, the best thing to do is to stay home. If you want, call your doctor, call your health professional, but don't run to the emergency room unless it's truly an emergency. And finally, I'd like to just address what I think is a very disturbing trend. Concerns about novel coronavirus should focus on public health and safety, not used as an excuse for anti-Asian racism or xenophobia. As I've mentioned, while the risk of novel coronavirus risk is still low, New Yorkers should remain vigilant in protecting themselves and their families, and we really should just stick together, not attack one another. We're going to get through this like we've gotten through so many other things. Thank you very much.
Well said, Commissioner. And just as the Commissioner said, yesterday we were contacted by the Federal Department of HHS and CDC on the cruise ship that was coming into the New York harbor. There have been no confirmed cases of coronavirus on that cruise ship. 4 people are being tested, but there were no confirmed cases, and we're working with them on that. And just to reiterate what the Commissioner said, there are no confirmed cases of coronavirus in New York thus far. We would expect, as time goes on, that we will find a case of coronavirus. If you look at the spread of it around the world, we would expect that, and we are prepared for that. We have taken a lot of time to put protocols in place and quarantine procedures, etc. But again, I understand the fear. We've gone through this before, Zika virus, Ebola, etc. But let's have some connection to the reality of the situation. And as the doctor said, catching the flu right now is a much greater risk than anything that has anything to do with coronavirus. Let me turn it over to Rick Cotton, who's the Executive Director of the Port Authority, who can speak about the coronavirus and how it's affecting flights, et cetera. Rick?
Thank you, Governor. At the Port Authority, we continue to work closely at all of our airports with our federal, state, and local partners, including the New York State Department of Health, to ensure that the mandated screening of returning international travelers to the United States is handled smoothly and without incident. Since the order went into effect on Sunday afternoon, at JFK, the CDC has screened 6,664 travelers. 3,100 of those travelers came on 14 flights nonstop from mainland China. The remainder of those screened, about 3,500, came on other flights and were flagged for CDC screening due to recent travel to mainland China. Of the 6,664 travelers who have been screened, 5 have been referred for quarantine. The Port Authority is prepared to continue to assist its partners as we work to protect the public health. Thank you very much.